Hello everyone, myself is Om Chaudhary and today we are going to discuss a topic about the family planning. So, this is why this is so important that we do family planning. Some of the couples they need there is so much benefits for the family planning, and we will discuss about that and the methods of the family planning. We are also going to discuss with the patient that how we deal, how we make them understand a couple. That's why family planning is a very important aspect for them. The main goals of the family planning. The goals of the family planning is to maintain the gap between the children's and for the proper and well-being of the children's and mother health, and for the to avoid the unwanted pregnancy we do this family planning. And for some other problems, like if mother is not ready to get pregnant, and they are if they are below the 20-year-old and 35 above the 35-year-old, there are some reason, and these are the goals for the family planning. So we are use uh, some methods and some medicines and some other things that used for the family planning. Firstly, we will going to discuss about the methods which can be used by the female, and in the female contraceptive device or the for the family planning we can give them pills. For example, there is medicine pills which have the combined therapy of the hormone estradiol and progesterone, and they also have IUDs, for example intrauterine devices. These include copper T and the other implants, and the cervical cups and tampons. These are the some medical these are some medical devices that can be used, intrauterine and devices for the control and prevention of the pregnancy or the family planning. They are must. And there is also mm, some surgical methods. Surgical methods can include both for the man and woman. There are hormonal implants that we can also use for the family planning or the to avoid the unwanted pregnancy. Implants are the those devices. These look like the matchsticks, and there's a rod and tiny rods which are inserted by the doctor subcutaneously, and they contain the hormones and they release slowly hormones. So they make the proper level of the estrogen and progesterone in the body. So a definite level of the hormones that avoid the ovulation, and the women can remain from the safe from the unwanted pregnancy. So there is a this is also method included under the contraceptive devices and the important for the family planning. And the third one is the surgical method. And surgical method is used for the men and women, for the both. This in this procedure we will perform the surgery for either the man or woman. In the men's, we will cut the vas deferens and tie the both the ends of the vas deferens, and we will suggest that do not do the sex or intercourse up to the 1 or 2 month, because there can be some semen can be remains in the tubes, and there may be chance of the pregnancy. And in the we cut the fallopian tubes of the woman with the laparectomy by the open surgery, and we make the incision, and we cut both the fallopian tubes, and we tie both the fallopian tube ends. And so this is the method. So we can secure or you can secure from the pregnancy, and we can stop the ovulation in the females. So they should not get pregnant after the intercourse or sex. And they have some contraindications also, and they have some benefits also. In the benefits we include they are the permanent method, so we do not need any hormonal therapy for the long term family planning, and for the long term to avoid the pregnancy. And they have some contraindication, like they are not reversible methods, so we cannot reverse them after the once they perform. They are permanent, they remains permanent. And this is all about the contraceptive devices and the family planning. And all the couples, they are young and newly married, and have better sex. For the better sex life they need to this family planning, and this is very much for them, and to control the population also, and the better health of women and children's, and for the better sex life. The family planning this is a very important issue for the couples, newly married couples. And This is all about the family planning, and thank you so much for the listening. Thank you.